Welcome, everyone, to another edition of SCRC's Let's Talk Caregiving podcast. I'm your host, Roberto Velasquez, President and CEO of SCRC, and I'm here as always with my co host, Marta Rañon, our Executive Vice President.
Hey, Roberto.
Hi, Marta. Today we have two special guests, Joe Gavin, Chief Program and Community Engagement Officer with the San Diego Seniors Community Foundation, and Isabel Lemos, Partnership Specialist with the U.S. Census Bureau. Welcome, everybody.
Thanks for
Hello.
having us on, Roberto and Martha.
We're thrilled that you are here to join us as we want to talk about the census and how it impacts our communities, especially for seniors. We serve some of the most vulnerable at-risk individuals in the county of San Diego. Family caregivers are already at greater risk for clinical depression and other health-related problems when compared to non-caregivers. And COVID-19 now only exacerbates caregiver stress, anxiety, and fear. And as a result, our family caregivers are in greater need of emotional support and professional coaching and counseling, like services that we provide at SCRC. So, how does the census impact all of us in this community and throughout the country?
Okay, I would like to thank you so much for inviting us to participate in this podcast with you today. The first thing I will have to say about how the census impacts our community is like a census is important for two things. That's what the main things that we say: political representation and also money. The census count is used to distribute more than $675 billion annually for the next 10 years. So that count is used to provide money to federal programs. More than 130 federal programs get money out of the census count. In California, if we, for a person that is not counted, we are losing around $2,000 per year for the next 10 years. So that means that a lot of programs that get their money based on the federal grant, they can be impacted. And of course, also the community residents, they provide those services. As an example, I would like to say that in last decennial census 2010, children under 5 is an example that I have for children. It's the one that always people get more excited. There were 2 million children not counted in the country. As a result of that, just in LA County, they lost for programs like Head Start $500 million per year for the next 10 years. So that means maybe they can hire less teachers, or in your case, if you have those adults that you serve, that you can hire maybe those professionals, those coaches that you need to provide assistance to those adults, or all the resources that you need to continue providing that great job that you're doing. So that's the impact of the census we have in the community.
Isabel, that's such a great point. And I'm so glad that you and Joe are here to really talk to us about how important this is. We are so sometimes complacent and unaware of how something as simple as filling out our forms and submitting it can have such a great impact on our community for years. And I really want to make sure that the people who are listening to this podcast today really understand the severity of not filling out a simple form online. I believe you have those online now, and really participating in the crucial process.
Yes, I wanted to add to what Isabel mentioned as far as like programmings. Now, for older adult specific programmings, you can cite things, of course, like Medi-Cal, which is crucial for older adults. Not only the medical services that are provided, but also things like long-term service supports, adult day health care that are funded through Medi-Cal, which is critical for older adults. SNAP, which is CalFresh or the food stamp program, is critical for seniors. The Medicare Part B premium that's paid for individuals who are dual eligibles, those who have Medicare and Medi-Cal, the Part B premium payment is funded through the census and what is allocated through the census count. Things like transportation, housing, various programs through HUD also reflect the census count. So things like housing, transportation, healthcare absolutely critical to all people, but certainly to the older adult population here in San Diego. So for, as I guess we'll lead into the next part about how people can get the census and how they can complete it. What can I segue into that and why it's a 10-minute process, maybe 20-minute process, depending on what modality you use. But for the investment of that time, what it rewards people back in the community is just absolutely essential and critical for everyone here in San Diego County, as well as in Imperial County, to fill out the census.
No, and actually, I did want to hear from you maybe the simple steps that are involved in filling out this form. I think sometimes we hear completing a form and think it's such a daunting task and it's going to take too much of my time. I don't have time for this. I'm a caregiver, I'm working, I'm trying to balance things at home. You're now asking me to fill out a form. So, what do you say to those people?
I will say that it's quite simple to fill out the census questionnaire. For the first time, we are going to be able to fill out the census online. So community residents can go to www.my2020census.gov and they can find the census questionnaire there. It's not going to take more than 10 minutes. The census form is available in 12 languages plus English. And so they can decide in which language they are going to respond to the census. And also we have a glossary in another 59 languages where they can have an idea what is the census asking in the case that English is not their primary language. We also have a call center where they can call and reply to the census over the phone. And it's important to address here that all the information that they provide is confidential. The U.S. Census Bureau can share that information with any other agency. If we fail in doing that, we can be fined. We are going to be fined, or we can go to jail. So the information is not shared with any other agency. The questions and the census are quite simple. The first question is going to be the numbers of people living in the household. We are going to be asking for the race, the ethnicity, the date of birth, the name, if the person is a renter or the owner of the house. Those basically are the questions of the census. We are not going to be asking for anything related to social security number, bank account, to provide donations. That is important also for the community residents to know that the census is not asking for those things, neither for the immigration status. So the immigration question about the citizenship is not in the census. It's quite easy, and with 10 minutes, you can provide funds for your community for the next 10 years.
And thank you, Isabel. And I want to go back to this, and Joe, maybe you can chime in on this. The data that we get from the census, we use all the time. We use all the time to make cases for needs of certain populations in our communities. We make cases to then extrapolate approximately how many family caregivers there are in our counties, across the state of California, across the nation. I know AARP puts out an annual report, status of caregiving report, and we use those calculations based on our census data for San Diego County to extrapolate and say that there's over 420,000 family caregivers in the county of San Diego. And that's really important for funding and programming and kind of being able to target different types of programs that we can then develop and provide out in the community. Joe, I'm sure you, working with the foundation, you utilize the data quite as much as well.
Most certainly, Roberto. For instance, right now we're working on a senior center master plan, kind of envisioning what we have about 28 senior centers throughout the county of San Diego. We've been looking at what exists now, and just as important, what the future is going to hold. So we've been very much utilizing the data to kind of, as you mentioned, kind of extrapolate and figure out what our senior population is going to look like, in certain areas of the county, income levels, things of that nature. Because really, in looking at the broad picture, there is no decade that has preceded us, or will probably happen in the future, where we're going to see this level of population growth amongst the older adult population. The United States will be adding over 18 million people over the age of 65 over this next decade. locally here in San Diego, we'll have almost 1 million people over the age of 60 by 2030. And to provide a little scale to that, from 2000 to 2030, that represents a population increase of over 525,000 people over the age of 60. To give you some context, that's the entire current population of the city of Atlanta, Georgia, a very large American city. That's the number of people we'll be adding to this community over the next, up until 2030. So what is it going to look like in terms of supports and services? As Martha and Roberto, as you are well aware of, the shrinking family and how that's going to impact caregiving, because you really can't mention the word caregiving without mentioning the word family, either right before it or right after it. And if we have a growing population that has less of a nuclear family support system in place, this is why, again, it's so important to get an accurate count, because maybe perhaps federal funding and state funding can help fill that gap that's going to be existent and growing over the next couple of decades.
So what I really appreciate you saying that, Joe, because we were actually talking about this, Roberto and I, earlier, and we were saying that if, we know that the demographics for the family caregiver are changing, right? It's a working 49-year-old female who's taking care of maybe children and elderly parents. But if that person right now is 49 years old, in 10 years, that person is 59 years old. And if they're caring for elderly parents, in 10 years, their needs are probably going to gradually change and need more services. So this is why it's so important for family caregivers to also participate in the census, fill out the questionnaires, let the government know this is what we are doing now, and probably what we will need in the future in our communities. We're all aging. We're all going to need some sort of community services in the future. So we need to make sure that we right now are setting up those frameworks in place in our communities and getting the proper funding for that.
Well, and I want to go back to, thank you, Martha. I want to go back to something Joe was talking about as far as programming and projections and so forth. Our communities throughout the country are becoming more and more diverse and multicultural families and multi-ethnic families. And the information through census helps us even look at pockets of population in different areas of different counties and look at programs for rural family members, people who live in rural areas. Look at specialized programs for Latino families. Look at special programming for the African American community. Look at special programming for the Vietnamese community. And this is all extremely important because we know as programmers, we know as people who develop programs, that you can't just make one size fits all type of program, especially when you're targeting minority populations. So this is part of a really important component, our CALMA program, which we developed in 2009 and is currently supported by the County of San Diego through the Behavioral Health Services, through the Mental Health Services Act of 2004. And this program was specifically designed, and it's an evidence-based program, specifically designed for the Latino community, family caregivers, and it has shown statistically significant changes in health and behaviors that have improved the lives of hundreds of Latino family caregivers. Isabel, you wanted to say something.
Yes, I would like to say that you have answered with that sample that you have been providing right now why we ask the questions about your race and ethnicity, because that allows us to focus in the programs, in the kind of programs that we need to set up for any specific area. We don't only want to know how many seniors are there in that specific area. We also want to know if those seniors have any language specific that we can provide. That's why sometimes we have questions like, if you also care about the amount of person in a household, what are you asking me? Date of birth, what are you asking? Ethnicity, language, race, and those information that we will need later for fund, those kind of provide money to those other programs that are based in that other information. Like, okay, we know that we have a certain amount of seniors in this area, but which language is what kind of demographic do they belong to. And that is also information that the census is going to be able to provide. And I would like to say another example now with the crisis, with the health crisis, we know like seniors are a very sensible community. The government, where they got the data to distribute ventilators, they went to the census. So they went to the census to know how many seniors were in each state, in which part of the state, and how to project that amount of ventilators that they need to allocate to each state. The information that they used was based on the census. The census compiled all the most complete information of our community, nationwide talking. So that's why it's so important to fill out the questionnaire and to respond to all of the questions that we are being asked there.
What are some of the biggest barriers for people to fill out a census? Because Isabel, at the beginning, you mentioned the millions and millions of dollars being lost for programming because people did not fill out census. What are some of the biggest barriers?
Well, in the case of seniors, in this year, the barrier can be that they are not familiarized with the internet practices, so they are not digitally savvy. So, if I can say, or proficiency, and they were waiting for that paper form. So many seniors, maybe they received the paper form. I have my personal example. My in-laws, my grandmother and my grandfather-in-law, I was telling them the census is coming, and I was explaining them how to do it. And the first thing they told me, when I let them know that for the first time you are going to be able to take the census online, they said, no, we are going to wait for the paper form. So it was like that. Then, when that was before the pandemic, when the pandemic came, I said, okay, now you're not supposed to go out because you have to go out to deliver that paper form to the post office, but you're supposed to be at home. No, we already used the internet and we did it online. But we know that not all seniors are like that. So that's one of the main barriers that we have. That's why we are letting the community know that we also have another channel, that is the call center. We have the national call center, and we also have a local call center. And I apologize, I don't have the number for our local call center right now, but it's something that I can forward to you so you can distribute to your clients. And we have been quite successful. We have been working with Joe. I was telling him that we had a campaign last week for the seniors they serve, and one day we got 50 calls. Seniors were calling to get assistance filling up their census questionnaire. We are really happy. And those are the main barriers with the seniors. Sometimes we also have many of the seniors or the caregivers that you provide services. They are also moms and dads. It happens with the children that they forget to count the children. They forget to count the newborn. They forget to count that 1, 2, 3 years old. They forget also sometimes to count that person that is temporarily living with them, sleeping in a couch because that person doesn't have where to go. And they assume that that's a person that is, because he's going to be there for a month or 2 months, is not living with them. They don't count that person. We also need to count that person that's going to be with us for 1, 2, 3 months because he's homeless at the moment. So in the case of seniors, we also have the barrier. They are used to the mobile questionnaire assistance. So they are used to go to the libraries as well. Sometimes they say, okay, I will go to the library and I will get support in the library or any other organization or institution that can provide the services. But now we can't because the libraries are closed. So that's why we encourage them to call our line, local line or nationwide line to get that census form filled up. We are working with some senior centers to provide a safe mobile questionnaire assistance in situ. It's going to be in some specific senior centers, but in the meantime, the best way is to reply online. One more time, www.my2020census.gov, or to call our local line to get their census form filled out.
So I just want to add to what Isabel mentioned as far as the barrier. And she mentioned the closure of senior centers and libraries that were going to serve as sort of satellite locations to provide seniors with support to complete the census. But obviously with COVID-19, that changed that trajectory. But and then there's an additional way people can respond is through the traditional enumerator phase, where a person will show up actually at your residence. And I believe that leg of the census will start August 11th, I believe, is the date, and will continue for the following month or so. The whole census process has been extended because of COVID-19. I think until October 31st now. It's been extended to, Isabel? Am I correct?
Correct.
Yes. So I mean, there's still ample time for people to respond. So either it's through the online process that Isabel has talked about, through telephone assistance, through the filling out of the paper application, and then beginning on August 11th, the enumerator phase, where people will go out in the community to get to try and attempt to account people that have not been able to complete the process through the other three steps.
That's fantastic. Isabel, Joe, it's funny, you mentioned, people hesitant to go online. I'll tell you that I've never been so uh, versed now on how to access information. I used to say, I'll never go shopping online. I'll never, do this. I didn't even want to use video conferencing before. It was kind of like, no, I'd rather call you or meet you for coffee. And now all of a sudden I'm online and doing everything online, and everything's becoming a lot more efficient, actually.
Yeah.
But I do enjoy seeing people on video conferencing. So I want to thank you very much for joining us. Well, it's all the time we have left for this edition of Let's Talk Caregiving. I want to thank Martha for co-hosting another important and stimulating discussion about caregiving and the census, and our guests, Joe Gavin from San Diego Seniors Community Foundation and Isabel Lemus with the U.S. Census Bureau. And I want to remind our audience that if you are providing support to a loved one, you don't have to do this alone. Asking for help is not a sign of weakness, it is a sign of strength. Just go to our website at scrc.care or call us at 1 800 827 1008. All our programs and services are currently available virtually online. Follow us on Facebook for more podcasts. And I also want to remind our audience that SCRC is a nonprofit organization, and we provide services due to the generosity of our donors and community partners. If you want to make a tax-deductible donation, please go to our website and click on the Donate tab. And remember, SCRC is here for you,
Caring for those who care for others.
Thank you.